Hello and good day. My name is Dr. Zero Million. I am the Health Emergency Management Staff Coordinator for Olongapo City. And today, our topic is about the role of the Health Department during disasters. As a Health Emergency Manager, you must recognize that there are three phases of a disaster. There is the pre-disaster phase, the disaster phase, or what we call the event, and the post-disaster phase. During the pre-disaster phase, the roles of the health department is limited to health emergency preparedness, mitigation, and prevention. The health department must be able to assess the risks involved in their area of responsibility. They do this by anticipating the problems that may arise in a certain community leading to a disaster. They must also reduce these risks that are identified by communicating the risks to the community involved and thus imposing behavioral changes to prevent disasters. Also, they do vulnerability testing and impose stronger resilience by involving the community with the healthcare staff or by creating a change in the local healthcare infrastructure and healthcare facilities. To prepare for an emergency, the health department must create a health emergency plan. They must train their staff according to that plan and exercise it through drills and evaluate each drill for completeness before an emergency. The health department must also try to build capacities before a disaster. Each type of disaster may require a different approach, so developing capacities to handle an all-hazards approach is the way to go. The health department must also install early warning systems. They may do this even without the hardware by creating memorandums of agreement with different sectors of the government so that the health department can be activated in case of a disaster. The health department must also be able to communicate the risks to the proper local chief executives and other administrative bodies that can help in the preparation prior to the disaster. During the disaster phase, the health department is limited to the health emergency response. During the disaster, the health department provides the leadership needed in the health sector. The health emergency manager must assess the health consequences of the disaster and its impact on the current health services. He must be able to determine the needs of the community and to protect the healthcare staff and the healthcare facilities. During a disaster, the health emergency manager must be able to provide at least basic health services needed in the community. He must be able to communicate the pre-identified risks so that you can prevent further disasters. Then, all resources available on the ground must be mobilized. And if there are resources coming in from other cities, he must be able to manage the logistics. The health information must be recorded and managed also, as well as the human resources coming in to the disaster area. The first 24 hours of the health emergency response is also called the immediate stage. The general needs of this stage are search and rescue, search and recovery, establishment of evacuation centers or shelter areas, bringing in of food and water, establishment of the public information system, establishment of emergency communication, and handling of logistics and reporting systems, which will include the injury and disability register. The health needs during this stage are first aid, triage, primary medical care, transport or the use of ambulances, and acute medical and surgical care. The short-term stage of the health emergency response lasts up to the end of the first week. The general needs during this stage are security, energy, environmental health services for vector control, personal hygiene, sanitary and waste disposal, and the health needs are emergency epidemiologic surveillance for vector-borne diseases, vaccine-preventable diseases, diseases of epidemic potential, and if there are, you must establish control of diseases of public health significance, control of acute intestinal and respiratory diseases, and there must be care of the dead and establishment of general curative services. Additional healthcare needs include nutritional surveillance and support, which may include micronutrient supplementation. If you have vaccines available for measles, you can give them, and with concomitant vitamin A supplementation. The end of the first month is usually called the medium-term phase of the health emergency response. The general needs of the people involved in the disaster are legal and physical protection, re-establishment of employment, public transport and public communications, and psychosocial services needed for people who have suffered psychosocial trauma. The health needs during the end of the first month are establishment or re-establishment of the health information system, restoration of preventive healthcare services such as the expanded program on immunization and maternal and child health care, and restoration of services for non-communicable diseases, obstetrics, and also the care for the disabled. The long-term stage of the disaster during the health emergency response may last up to the end of 3 months. The general needs during this stage are education, re-establishment of agriculture, and environmental protection. The health emergency manager must be able to activate the reconstruction and rehabilitation plan that was made prior to the disaster. Since there will be a need for more healthcare workers, specific training programs to address this will have to be created. The health information and health education programs can also be continued, as well as the disability care and psychosocial care. The last phase of the health emergency response is called conclusion of the disaster. The general needs are compensation for the healthcare workers that volunteered for the disaster, the reconstruction and rehabilitation of the healthcare system so that it may continue to function after disaster, and as part of the evaluation, the creation of a prevention and preparedness plan. For the health emergency manager, the needs are 1. Evaluation of the lessons learned from the disaster. 2. Revision of policies, guidelines, and procedures concerning the response to the disaster. 3. Upgrading of the knowledge and skills and adoption of attitude change. For the post-disaster phase, the role of the health department is limited to recovery and reconstruction. To institute measures for recovery and reconstruction, the health emergency manager must be able to assess the health needs of the community over the long term. He must be able to provide at least the basic health services after the disaster. He can do this by restoring the health services, the health facilities, and reconstructing health systems. The health emergency manager must also be able to develop human resources available and plan reconstruction for the health facilities and able to reduce risks. And that's all for today. Thank you very much for listening to this presentation. It actually came from Module 1 of the 6th Interregional Training Course in Public Health and Emergency Management
in Asia and the Pacific, which is also known as the FEMAP.
These slides are actually a prerequisite for my next video, which is a commentary on the role of the health department during disasters. This video, when available, can be accessed by clicking on the call to action on the left of your screen. I also added a link for a book regarding health emergency management, which is the Healthcare Emergency Management textbook, if you're interested in health emergency management. Again, if you're on Facebook, I can be followed on facebook.com/0million, and on Twitter I can be found at twitter.com/0md. Again, thank you very much for watching and going through this episode. I'm Dr. 0million. Mabuhay.